The Gorakhpur hospital deaths in the state of Uttar Pradesh have shaken the middle classes, media, and the establishment in India. Totally preventable and avoidable deaths of scores of children in a teaching hospital in this day and age is an unspeakable tragedy. But if we see it as an isolated incident, then it will be particularly unfortunate, because we are losing every year in India 1.2 million children entirely unnecessarily due to preventable causes, only because of failure of healthcare system. There is a deep crisis in healthcare in India. India spends one of the lowest amounts on public health, about 1% GDP. As a share of total health expenditure in the country, the public spend is only about 20%, again one of the lowest in the world. The results are catastrophic. Annually, 1.2 million children are dying, unnecessary deaths in the country below 5 years of age. Every year we have about 10 million new cases of malaria and 2.5 million new cases of tuberculosis. Between 40 and 60 million people in the country are falling below poverty annually, even when they were above poverty earlier, only on account of healthcare costs and catastrophic illness. The gruesome tragedy behind these numbers is unbearable. What is particularly unfortunate is that India has the capacity to overcome this. With only 1% GDP additional expenditure judiciously deployed, we can largely overcome the healthcare crisis in the country. We have tremendous strengths. India has more than 1 million qualified doctors, about a quarter of whom are underemployed. We have equally large numbers of paramedical personnel, nurses, pharmaceutical agents, and so on and so forth. India has tremendous expertise in its doctors and health personnel. Our pharmaceutical industry is a world champion. In the wake of the AIDS crisis in Africa, once Indian companies reduced the drug prices, the global prices plummeted. If only we leverage our strengths and spend just 1% more GDP, utilize public sector and private sector sensibly, create a system of competition, choice, and sensible expenditure, India can overcome this crisis much more easily than most countries. We must view this in the larger context of Indian democracy. India embraced universal franchise and liberty as a poor nation, one of the first in the world. We are a remarkably successful democracy. There's peaceful transfer of power. We preserved liberty. We built a strong, multilingual democracy, respecting diversity. And yet, abject poverty and universal franchise are sometimes very difficult to reconcile. There is always a temptation to resort to short-term freebies in order to maximize instant gratification. Therefore, the focus of the government has not been adequate in critical areas of education, healthcare, service delivery, and rule of law, the core functions of government. If the Indian state sets its house in order, we can easily emerge as a global example, not only as an economic giant, but also as an important global example of how to achieve prosperity and equity while preserving democracy and liberty. I hope the Gorakhpur crisis will be a wake-up call for all the establishment in India, and instead of the typical traditional diatribe and blame throwing, we will all focus on what needs to be done in terms of overcoming the healthcare crisis in India, and in general in terms of improving the quality of governance through meaningful reforms at a relatively modest cost.